Hi everybody, I'm DrNari Heshmati. I'm a board-certified OBGYN in the North Puget Sound area near Everett, Washington. And today I'm back at Mukilteo Beach, so got a nice background in the back like we always like to have. And I want to talk to you about an important topic, depression, but specifically postpartum depression, or depression that happens after a pregnancy. And I want to start off by saying, this is another one of those difficult topics. It's difficult for providers to talk about. It's difficult for patients to talk about. We often look at the fact that if I tell you you have diabetes and I want you to see my buddy the endocrinologist and he writes you a script for some insulin, you don't mind doing that. If you go to the pharmacy and you pick up insulin, you don't feel ashamed. You don't feel that something's wrong because we're treating a medical condition. And we need to get away from the stigma that we have on depression, because if I tell you have depression and I want you to start an antidepressant or go see the psychiatrist, that's something people are very reluctant to do. And I think it's very important for us to acknowledge that you can't have physical health without mental health, and these things go hand in hand. And just like diabetes or high blood pressure is a medical condition that needs to be treated, depression is something that we have to treat, we have to acknowledge, and we have to move beyond any kind of stigma. Now, postpartum, it's a stressful time. It's very common for women to feel down. Women will feel depressed. They won't want to do activities. They can even feel irritable or angry and feel like they can't take care of their child or get angry at their spouse. Oftentimes, these symptoms are mild, and there's something that's going to go away on its own. So what we call the postpartum blues, that's something that starts within 2 or 3 days of delivery and usually resolves on its own in about 2 weeks and doesn't require any treatment or any medications or anything like that. It's just something we need to be aware of, and it will get better on its own. You shouldn't feel bad if you have those symptoms. It's very, very common. 40 to 80% of all pregnant women postpartum will have the blues. So if you think about it, next time you're in a group of women who have had children, more than half of the women in that group felt that way. Now, on the other end of the spectrum, we can have more severe symptoms that are actually full-blown depression. And that's also common. 8 to 15% of women postpartum will actually have depression. And the difference between postpartum blues and depression is really the severity of the symptoms. So, in addition to feeling down, you just don't have joy in doing activities. You're having trouble sleeping. You're not eating. You're having such severe symptoms that it's really affecting your daily tasks. Now, it can be very, very extreme to the point where you have thoughts of hurting yourself or hurting other people. And if that happens, then that's something very important. Whether you call the crisis hotline, go to the emergency room, you need immediate care. But let's just say you're feeling depressed. Now, that's something that usually we're going to start within about 2 weeks of being postpartum, but it can be longer. And that's something that often is going to need some kind of treatment. And that treatment can be something starting with counseling, is what I like to oftentimes send patients to help talk and see if things get better, or antidepressants and medications. Now, I always do put a caveat. It can take up to 4 to 6 weeks if you start an antidepressant before we start to see effects from that. But really, it's important to realize that, when you're postpartum, you're tired, you're not sleeping well because you've got a baby, but not to let that confuse and mask if you're actually feeling depressed and if it's something that needs treatment. Because finding that out, acknowledging it, and seeking treatment is really the most important thing. So if you're finding, I don't feel like doing activities, I'm feeling really down, that's a sign that maybe you might need some kind of help or treatment. Now, why does that happen so commonly postpartum? And there's a physiological reason that has to do with hormones. So you've got a very high estrogen progesterone state during pregnancy. Now, postpartum, that drops down, and that probably helps trigger a lot of these depression symptoms. So women who, for instance, are more sensitive to that probably are more likely to get depression. Somebody a while back did a study. We've got a shot called Depo-Lupron that we can give women. It basically puts them into medical menopause. It shuts down all their hormones. So they did that. Then they gave them really high doses of estrogen and progesterone, so it mimicked where you were in a pregnancy. And then they took away that estrogen and progesterone, just like we see after a delivery. And a lot of women became depressed. So we've got some reasoning that comes with that. The other thing, though, that's factored in all this is it's a stressful time. There's a newborn in the household. This is going to be stress for you, stress for your spouse, for the family. You're at a higher risk for depression if the baby is sick in the intensive care unit, if you've got more than one baby, if you've had a history of depression, because all these things can just counter onto themselves. And, a sign of how stress can factor into this is men also postpartum have a higher incidence of depression. So about 8 to 10% of men after their wives get pregnant or spouses get pregnant will have depression and depression symptoms. So that's probably all the stress and everything that's going on there. And so this is something that we look at, and it can create difficulties. It can create difficulties in your relationship. It can create difficulties in raising a child. And so it's really important, if you're starting to feel depressed, to realize it, to acknowledge these symptoms, to know that this is not something that has to have a stigma, that's not something you have to hide behind or keep to yourself. This is something that happens. And just like if I've got to give somebody blood pressure medicine or diabetes medicine, it's something that needs treatment. So if you're feeling depressed, we need to start. Maybe get you to a counselor, make sure you've got a good support network of friends and family, and then if we need to, start an antidepressant or something that's going to help balance out some of those hormones and those chemicals to get you feeling better. So, you know, I hope this is something that makes it a little easier and more open for us to talk about depression, and I hope this is something that when you look around you realize that it's been affected by a lot of people. And it's something that we really need to move beyond, and we need to have better health with and do better with. Thanks a lot.